Mistakes happen, whether it's a broken condom, accidentally skipped birth control, or a partner who promised that they'd pull out. Emergency contraceptives are essential when things don't go to plan. Also known as the morning after pill, emergency contraceptives help prevent pregnancy after unprotected sex or when birth control fails. It's a great backup to have when the unexpected happens, but it shouldn't be your main method of birth control. This miracle of science works by delaying or preventing ovulation. With no egg available to fertilize, you won't get pregnant. But there is a catch. If the egg has already been released into the uterus, the pill won't do much. There is no need to worry about the pill affecting the health of your new fetus. The morning after pill is not an abortion pill, and it will not end an existing pregnancy. This catch is why timing is crucial for the pill to work. Even with perfect use, it may not help. If the egg has already been released before you can nab a pill, you're out of luck. There are two kinds of pills available in Canada: levonorgestrel, which is available over the counter, and allopristol, which requires a prescription. While both are effective at preventing pregnancy, you cannot take both within the same week. The pills cancel each other out, so if you do, you'll be more likely to get pregnant. Levonorgestrel costs $15 to $35 and is available at any sexual health clinic, pharmacy, or Costco. Costs will vary depending on location. For the best chance at preventing pregnancy, take Plan B within 24 hours. While it can be taken up to 72 hours after sex, the pill is less and less effective every extra hour after day 1. A crucial but little-known fact is that Plan B has an easy-to-hit weight limit. If you weigh 165 pounds or more, the pill will be less successful. Of course, people above this weight can still take the pill, and it may still work, but prescription options are more potent and more likely to help. Emergency contraceptives will react with hormonal birth control, and it's important to understand how. After taking Plan B, hormonal birth control will not work for a week. Use non-hormonal methods like condoms to avoid pregnancy in the meantime. Allopristol costs between $50 to $90. It's available at any pharmacy, but you'll need a prescription first. The stronger option, Ella, can be taken up to 5 days after unprotected sex and still be up to 85% effective. But remember, if the egg has already been released, the timeline no longer matters. Ella also has a weight limit that's important to know. It will not be as effective for anyone who weighs over 195 pounds. Pills like Ella can cancel out the effects of hormonal birth control for 5 days after taking it. Use non-hormonal methods during this time instead. Breastfeeding mothers can feel safe taking either of these pills. Plan B has no effect on breast milk, so mothers can feed freely. With Ella, mothers should discard their milk for 24 hours after taking the pill, but can then resume normal feedings. Like any medication, there are some side effects you should know. Contact your doctor if you vomit within 2 hours of taking the pill. They'll tell you whether or not you should take another dose. Emergency contraceptives can delay your period for a week. Keep track of your first period post-medication and take a pregnancy test within 4 weeks of your missed period. Plan B doesn't work for everyone, especially considering its weight limits. But luckily, there's a Plan C, copper IUDs. A copper IUD works a little differently than the pills. Rather than changing ovulation, copper prevents the egg from implanting and being fertilized. Though it can cost anywhere between $50 and $350 depending on location, it has an added bonus of also working as non-hormonal birth control. Copper IUDs are the most effective form of birth control and can last up to 10 years. It can work as an emergency contraceptive up to 5 to 7 days after unprotected sex. Along with insertion pain, copper IUDs come with some side effects. Take control of your sexual health and family planning. Subscribe to the Health Insider to learn more about Canadian healthcare.